Number 1 is P wave. Number 2 is the PR interval. Number 3 of the QRS durations. Number 4 is the RR interval. Number 5 is the heart rate beat per minute. And then we got the conclusion. P wave, it must be small, rounded, positive, uniform in all beat. What are we looking for in P wave is the small, rounded, positive, uniform in all beats. It came in the same duration in all beats. But P wave, it can come alone. Only have P but no QRST. P came alone, no QRST. So this is we call miss beat. If we see miss beat, it means the rhythm is hard block rhythm. If we see P is miss beat, mean P come alone and no QRST. This is P miss beat. P miss beat means the rhythm that we are going to interpret is one of the hard block rhythm. P can also come with fibrillating wave. Fibrillating wave before the QRS narrow. If we see the fibrillating wave like this before QRS and the RR interval is not regular to each other, so this is the atrial fibrillation. P also can come with fluttering. This one is the fluttering. We call it broad P at baseline. Broad P, broad P, broad P at baseline. This is we call as saw tooth. Broad P at baseline. When we see this broad P or sawtooth at baseline, it was a atrial flutter. P also doesn't come after the QRS. It's a straight, no P wave, QRST or P inverted QRST or P after the QRS. Straight line, no P, QRS or inverted P wave or P retrograde or after QRS there is a small rounded positive wave. After the QRS is the P wave. So this is when we see in the rhythm it was junctional rhythm. So no P, straight line QRST or inverted P QRST or P after the QRS. This is we call as a junctional rhythm. There is a complete beat miss here. Complete beat missing. No PQRST. This is we call sinus block or exit block. If sinus block more than 2 beats missing, it was sinus pause or sinus arrest. If we found in the rhythm there is a complete beat missing, no PQRS. T means one beat missing. One beat missing is a sinus block. If sinus block more than 2 beats missing, means it was sinus pause or sinus arrest. If we see in the rhythm there is a spike line before the P wave, means this is the pacemaker spike line. The patient has a pacemaker that the pacemaker lead is inserted in the atrium. So spike line before the P, it was an atrial pacemaker rhythm. So this is all about P wave.